So it was a ripple effect. Yeah, it was doubling. Yeah, we resolved that issue. Yes, as we testing now. No, you change the ratio.
Okay, but cool. Hi, hello. 1 2 1 2. Engathi ngu-DJ. Hello? 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 Okay. So you're gonna keep it off.
It's fine. I'll just mute you.
Okay.
I'll mute you.
Let's start. I'd like to introduce you to Professor Luongo from the United Nations University for Peace, who's doing our report for us.
Good of this
Thank you very much. Can we all please settle down now for the next session? Those who are still outside, please come back inside and let's continue. Excellencies, colleagues, friends, let's settle down, please. Let's continue. We don't want to keep you here longer than you have to be here. Thank you, colleagues. Thank you so much. We sincerely appreciate your patience with regards to the technical issues we've been facing. We've been assured by the team that they've taken the break to try and resolve these issues. So we really appreciate your patience. Let's carry on with the program, colleagues. We're really going to get into the weeds of it now and start really dealing with implementation. However, in the meantime, what we will do is we will start with the 2 high-level addresses that we missed in the last session. So let me just get an indication from the technical team. Are you ready with the AFTCA CEO's message, please? Okay, so we will first start with His Excellency Wamkele Mene's message. And we will then also receive the message from the President of Afrexim Bank, Professor Orama. But let us first get a very, very important message on issues of trade from His Excellency Wamkele Mene. Thank you.
Ladies and gentlemen, honorable ministers, let me start by appreciating the opportunity to address this high-level ministerial dialogue on industrialization of Africa's pharmaceutical sector. Under the leadership of the African Union and through implementation of the AfCFTA, we have established a solid foundation for economic integration on our continent, as well as rapid industrial development. The AfCFTA is not merely a trade agreement. As one of the flagship projects of Agenda 2063, the Africa we want, it is a continental blueprint for transforming Africa's productive capacity, fostering value addition, and deepening intra-Africa trade. The pharmaceutical sector is a very strategically important sector of Africa's economy. However, imports of over 80% of pharmaceutical products from around the world at an estimated annual cost of $16 billion continue to constrain Africa's productive capacity. This over-reliance on imports has exposed our vulnerability to global supply chain disruptions as we observed during the COVID-19 pandemic. Strengthening local manufacturing is both a health imperative as well as an industrial policy imperative. Furthermore, it shall offer opportunities for job creation, innovation, and reduced inequality. I am pleased that under the leadership of Africa's CDC, the African Union has set a very ambitious target to produce at least 60% of the continent's vaccines by the year 2040. Therefore, today's dialogue presents an opportunity for us to reaffirm our political will, to mobilize partnerships, and to advance practical solutions to achieve this ambition. Together, through collaborative action and strategic investments, we can build a resilient, self-sufficient, and inclusive pharmaceutical industry in Africa. Projections by the United Nations Commission for Africa, as well as the African Development Bank, indicate that the pharmaceutical sector in Africa is well poised for significant growth over the next decades. This expansion shall be driven by a combination of factors, including a growing population, rising healthcare needs, rapid urbanization, and growing income of African households. Therefore, deliberate interventions to boost intra-Africa trade in pharmaceutical products and production of those pharmaceutical products remains a key objective of the AFCFTA. In collaboration with Africa's CDC and other partners, we are fully committed to building an integrated, harmonized, and competitive pharmaceutical sector in our continent. The combined effect of the pooled procurement mechanism as mandated by the 37th Ordinary Session of the African Union with trade policy tools that are presented by the AFCFTA, such as rules of origin, we are well poised and well positioned as a continent to accelerate pharmaceuticals production in Africa. I therefore wish to commend and appreciate the leadership of Dr. Jean Kaseya, the Director General of Africa's CDC, whom we fully support in ensuring that we deliver on this ambition by the year 2040. The successful industrialization of Africa's pharmaceutical sector will mark a critical step towards stronger healthcare systems, greater self-reliance, and meaningful contributions to global development goals. In this regard, the G20 is an important platform for us to engage and mobilize our international development partners. Africa's prosperity and indeed health security depends on our ability to deploy trade tools at our disposal, such as the AFCFTA, our technical expertise that reside in Africa's CDC, as well as the political will of our heads of states, are key factors that will enable us to meet this ambition. The AFCFTA is an important tool that will enable the rapid industrialization of Africa's pharmaceuticals production capability, where we effectively deploy the trade policy tools that the AFCFTA provides. I wish to reiterate our commitment with Africa's CDC and our partners around the continent to ensuring that by 2040, indeed, Africa does produce over 60% of our vaccines. I thank you for this opportunity, and I wish you very good deliberations.
Thank you very much to the SG. If there's any doubt whether all of the AU agencies and whether the AU heads of state and our ministers are together on this agenda, there should be no doubt now. I think you have heard from all of our leaders that we're all singing from the same hymn sheet. And this should really foster a lot of investor confidence. And we really thank our leaders. It hasn't always been this way, that there's been such a coherent agenda. I would like to invite Mr. Yusuf Daya, who is the Director of International Cooperation at AFRIXIM, to please deliver the address on behalf of the President of AFRIXIM. Thank you very much.
Good afternoon, everyone. Allow me to stand on established protocol as well, and also to extend appreciation for accommodating that I deliver these remarks on behalf of President Orama. I think it's a testament to how important he feels this event is, that he called me during the tea break, noting that there were technical challenges, and said, Yusuf, please speak to the organizers and make sure that my statement is read out. So thank you very much for accommodating us. So I'll be reading President's statement word for word. It's not my words, so let me start off. It gives me great pleasure to address you this morning. I would like to thank the organizers for inviting me to deliver this keynote address through a virtual platform, necessitated by conflicting schedules. I thank His Excellency President Ramaphosa, the African Union champion on pandemic prevention, preparedness, and response, for prioritizing health security and pandemic preparedness under South Africa's G20 presidency. It is not surprising, given that President Ramaphosa took on the chairmanship of the African Union in February 2020, just as the black swan global health crisis, the COVID-19 pandemic, set in upon us with the ferocity of a hurricane-force wind. He was saddled with the arduous challenge of visioning and executing Africa's response. As one of his foot soldiers in delivery of that Herculean task, I can confirm, as I believe that many of you would, that he came out with flying colors, evident in the continent suffering the least number of infections and casualties. But in that process, President Ramaphosa discovered, just like all of us who worked with him discovered, health security cannot be realized in the absence of health sovereignty. We all found that in times of global health emergency, the animal instinct will trump all considerations and survival of the fittest would reign. Everyone for himself and God for us all would become the order of the day. We all found that one can have all the money in the world and yet be denied access to critical life-saving pharmaceuticals and medical equipment. I personally learned a key lesson about the sharp difference between the health security and health sovereignty during the pandemic. As vaccines emerged, the African Export-Import Bank approved a $2 billion facility to back Africa's pool procurement mechanism under the Africa Vaccine Acquisition Trust set up by President Ramaphosa. We quickly found out that no one was willing to sell us any vaccines. And it was just because that we had Aspen Pharmaceuticals on the continent in South Africa doing contract manufacturing of Johnson & Johnson vaccines that provided an opportunity for President Ramaphosa and the coordinator of AVAT, Mr. Strive Masiwa, to drive a hard bargain with the European Union, which then made it possible for AVAT and the continent to secure over 220 million doses of the vaccine. This is good occasion to thank Aspen CEO, Mr. Stephen Saad, and his colleague, Mr. Stavros Nikolaou, for helping us make that possible. But what if we didn't have an Aspen on the continent? I recommend that we keep this question in our minds as we discuss today. It is not acceptable that a continent of about 1.3 billion people can only boast 375 pharmaceutical manufacturing entities, most of them in two countries, South Africa and Egypt. And yet, the continent is exposed to many infectious diseases and lately non-communicable diseases due to a rising middle class. To reverse this situation requires the creation of manufacturing capacities across the continent. This can happen if we are deliberate about how we finance it. We must rid ourselves of the pipe dream that others will finance our goal of attaining health sovereignty. We must come to terms that this is our destiny. We must claim by supporting African institutions to rise to the challenge, again in a deliberate manner, devoid of being hostage to the delusionary so-called international best practice. If the African Export-Import Bank did not rise to put $2 billion on the table to support COVID-19 pool procurement initiative, it would have been stillborn. But beyond financing, our business people cannot invest to create the manufacturing capacities unless there is a market for the products. Africa can also do something for itself here and implement an initiative introduced by President Ramaphosa in 2022 and approved by the African Union to procure 30% of their pharmaceutical purchases from the continent. If we do that, this would instantly create a ready market of $9 billion for the African pharma industry and make projects more bankable for support. The AFCFTA agreement presents a platform for duty-free trade in these products. And through our grant financing, Afrexim Bank has supported the harmonization of standards for pharmaceutical and medical equipment in partnership with the African Regional Standards Organization, the AFCFTA Secretariat, and the African Union Commission. So right now, the governments just need to act. I must at this juncture also commend His Excellency Dr. Jan Kasaya, the Director General of Africa CDC, for prioritizing this initiative and working with us to use the African Medical Supplies Platform to pool continental demand towards this goal. But as this is a G20 meeting, there are things the powerful G20 economies can do to support Africa. Not just because it is their humanitarian duty, but also because it can guarantee their own health security. Although the multilateral system is today significantly challenged, we believe that something ought to be done in removing intellectual property protection constraints in drug manufacturing in poorer economies, especially during the time of emergency. They should take a holistic approach at patent protection for certain kinds of drugs. Is there a way to work in the interests of countries from where certain active ingredients of drugs are discovered and sourced? How can G20 economies encourage their pharma industries to do drug trials on the continent? How can they support African economies to create the capacity to join the new trend of using biologics in pharma? At Afrexim Bank, we recognize that we must, within the limits of our resources, align with Africa as we fight the health security and sovereignty battle on all fronts. Your Excellencies, I am pleased to state that Afrexim Bank has been at the forefront to drive transformation of the structure of African trade through aggressive support for, among others, industrialization and export manufacturing. To boost industrial development, we have partnered with Arise Industrial Parks to create world-class industrial parks and support $1.8 billion to 10 African countries to develop and expand industrial parks and special economic zones, including Nigeria, Cote d'Ivoire, Chad, Kenya, the DRC, and Malawi, amongst others. These industrial parks and special economic zones present an ideal logistical platform to establish pharmaceutical manufacturing plants. We're also working with Africa CDC to support the health product manufacturing ambition of the continent that will cover various products, including vaccine and pharmaceutical manufacturing. Under this program, we have committed a $2 billion facility towards Africa CDC's Africa Health Security Investment Plan. This plan will allow Afrexim Bank to support and finance key health manufacturing projects after being pre-screened by the Africa CDC to affirm technical feasibility. The joint effort combines technical and financial resources, financial tools such as equity and debt financing, guarantees, capacity building, and risk sharing to boost and attract more health investment in Africa. Afrexim Bank is also working with Africa CDC and the UNECA to develop the African Pool Procurement Mechanism. The pool procurement mechanism is very important as it creates predictable demand so pharmaceutical manufacturers can plan for the long term to create viable manufacturing ecosystem. Africa CDC estimates that the African market for medicines and vaccines, when aggregated, is approximately $50 billion annually, affirming that local manufacturing is viable, albeit at scale. Through a pool procurement mechanism, AU member states will benefit from competitive prices due to the synergies to be unlocked. Your Excellencies, distinguished ladies and gentlemen, we at Afrexim Bank, and in line with our mandate, have noted with keen development interest the recent advances in science and how research-led evidence building and modern therapeutics are offering insights into management and even the cure of major diseases. The opportunity to advance life sciences capabilities across Africa by mobilizing research and knowledge to tackle diseases of interest to people of African descent, for example, sickle cell anemia, is significant. However, lack of adequate investment to research and develop cures for these diseases has stalled their management and cure. Also concerning is the lack of clinical trials on Africans when new drugs emerge, leading in many cases to some of these medications not being as effective on peoples of African descent. Furthermore, recent developments in the world have shown that there is a positive correlation between life sciences research and discoveries of new drugs and socioeconomic development. The onus falls on institutions such as Afrexim Bank to advance the agenda of equitable healthcare for all and to achieve universal health coverage as aspired to under Agenda 2030. In response to this, the board of Afrexim Bank recently approved the establishment of an African Life Sciences Foundation and its supporting endowment fund. The foundation represents an opportunity to invest strategically in research and innovation in order to significantly improve responses to Africa-specific diseases, deepen understanding of global health conditions as they manifest within African populations, and mobilize knowledge transfer effectively. I am pleased to report to you that Afrexim Bank will be seeding the foundation with a donation of 75 million US dollars. We intend to mobilize over 650 million US dollars in the medium term from our strategic partners, and we call on G20 economies to support this effort. Distinguished ladies and gentlemen, as I draw to a close, I would like to inform you that Afrexim Bank will be commissioning the 170-bed African Medical Center of Excellence in Abuja, Nigeria on the 5th of June this year. This groundbreaking level medical facility, spearheaded by the bank in partnership with King's College Hospital, will serve the entire African continent, focusing on 3 non-communicable diseases, including oncology, hematology, and cardiology, in addition to the provision of general care. The first phase of the African Medical Center of Excellence, Abuja, has been developed at an initial cost of 300 million US dollars. The AMC will stimulate intra-African trade in medical services and strengthen critical supply chains in pharmaceuticals and healthcare delivery. For too long, our continent has borne the heavy burden of non-communicable diseases, capital flight from medical tourism, and the exodus of skilled professionals seeking opportunities abroad. The AMC in Abuja is set to change this narrative. This initiative is more than an investment in infrastructure. It's an investment in Africa's future. Through strategic partnerships with governments, international stakeholders, and the private sector, we are demonstrating that Africa has both the ambition and capability to provide world-class healthcare for its people. The AMC Abuja is not just a medical facility, it's a statement of intent, a symbol of progress, a beacon of hope for a healthier, more self-reliant continent. As it prepares to open its doors, the vision of the world-class medical ecosystem continues to take place. The full development of the AMC campus will further solidify its role as a center of excellence in healthcare, education, and research. Following the commissioning in Abuja, the bank intends to commence development of 2 more such centers, one in East Africa and the other in Central Africa. As this new public health order emerges, I am filled with optimism for the future as we take our destiny into our own hands. A future where every African citizen, whether on the continent or in the diaspora, enjoys a birthright of good health, and well-being. I wish you a successful session and thank you for listening. Professor Benedict Ramu.
Well, I'm so glad we did not miss that incredible message and the very, very exciting announcements. And please do thank the President for us, please, for his wonderful, wonderful leadership ever since he was a special envoy. And, but I do want to just add one more thing to his ask to the G20 countries. And that is, please, can we keep the Joint Finance Health Task Force together and to keep it going? It is under threat. The interest, particularly from ministers of finance, is waning. And if there's one thing that we can do as a G20 community for health security, is to really keep that task force together, particularly in these very, very difficult times that we are all facing. Now, without much further ado, we're going to now move on to the technical aspect of this discussion. And here's what we're going to do. We are going to invite the United Nations University for Peace, Professor Juliano Luongo, to come and just frame the conversation for us and put us into an academic frame of thinking. And then we're going to have 2 panels that are going to follow. Now, we are already a good hour, if not a little bit more behind. So I have requested the panelists, or the panel directors, to please cut the sessions by 15 minutes. They were supposed to be 45 minutes each. We're going to push for them to try and be done in half an hour. At the 25-minute mark, I will stand to indicate that there's only 5 minutes left for the panel. And so we're also just kindly requesting that the panelists also just get to the point, keep it brief, and get down to the practicalities. I think we've heard all of the political positioning now. Now we just want to know exactly what it is that we need to implement, and I'm sure everybody will appreciate that, and then we will try and get to lunch on time. So then, Prof, please do come and assist us to frame our thinking. Thank you.
Thanks a lot, Luazi. Thanks, everybody, honorable ministers and representative of the authorities, distinguished colleagues. Thanks a lot again for your presence, and thanks a lot for participating in this important event. I am glad to have been tasked as a partner of the African Prosperity Fund in drafting the report that we'll try to give as our best scientific and academic basics to the research in order to understand the way forward that we have to take. I am very glad that after listening the intervention of the other professionals gathered together today, there is already a lot of accordance and gathering on what are the main issues, and also what are the main aspects, the main parts of how to arrange and get ready to understand the way forward in order to improve the African medical framework. So the two main aspects that I want to underline in this introduction to the technical part, in which, as also suggested, I will try to make myself as shortest as possible. So I also see that we have plenty of objects that you can throw at me if you see that the session is taking too long. The first topic will be about the idea of the pooled procurement system. As we know, this is an important system that that is starting to be framed by the AFCFTA and also by the Africa CDC, and that these kind of systems already have a very strong, how can I say, has been already underlined the importance of this kind of systems already in the international cooperation framework. We already have some important documents, for example, from UNCA, from WHO, that underline how this kind of the implementation of this kind of systems can forward and ease the production and distribution of pharmaceutical products in the African continent. We know how critical is the situation at this point and why we need to make very important steps forward in this process. The most important points that already came out of the early stages of research are how such a system can increase can improve quality and transparency of the procurement system and thus of the quality of pharmaceutical products that will be distributed. As well, such system can help in reducing prices through volume discounts and also enhance the supply chain resilience by this way in order to avoid the issues in stockouts of medical products. Last but not least, these processes will bring to a very tangible strengthening of local manufacturing, which is a very critical point, which is trying to be tackled by the United Nations for a lot of time. I personally remember that this goes back my very first task in the United Nations system between the United Nations Conference on Trade and Development and WHO, when the issue of improving and strengthening local production of medicine was starting being tackled and promoted through critical stakeholders and critical policymakers. Improvements under this sector can be relatively easily calculated by the implementation of the multiplier effect, which maybe if it can sound as a very basic system to measure how to calculate improvement in an economic system, became fundamental in this very specific case, because it can have us understand how tangible can be focusing and improving local production in single countries framed by a pooled system for procurement. So we can see how the two elements get tied strongly together. The main case study that we will present in the report that we are going to work on is obviously the South African case, since that South Africa has already a good experience in these kind of focused activities, and also in the African territory is the country which has the most stable and structured background and structure in order to further this kind of activities. Now, focusing on the effects of the multiplier effect, we can simply see how this kind of empowerment in local production can offer many positive spillover effects in other various domains. We are not just talking a single sector and improvement of a single sector. We can have many backward linkages and the expansion of supporting industries, and with obvious positive effects on the employment rate, converting itself in an increased tax revenue for the country. Naturally, these elements will be calculated and will be presented with more figures during the development of the report about which you will be updated in due course. Just to make some simple examples, if we think about the linkages to the market of local APIs, a scaling, a proportional scaling can have the sector grow by 8 to 10 billion rand per year, as already stated by the DTIC of the South African government. In addition, these kind of figures are already supported by the UN Comtrade and also by independent statistical aggregator. So the basis, as you see, can be very easily framed and very easily targeted with an important commitment that we can do, that we are going to do, as the other stakeholders presented earlier today. So connecting together political and economic will, economic engagement, as well as supporting this with further guidance of academic research, going to rebuild one of the usual triangle of public-private cooperation involving the support of academic sector. There will be a wide room for improvement and empowerment on the sector in the country, bringing also the known benefits of strengthening a country's economy through the improvement of the health levels of its citizens. So on this way, having the understanding of the way forward, the call is to have the will to transform all of the theoretical commitments into practice, as our colleagues already shown that is possible. So I will just leave the word to our distinguished colleagues to further the technical conversation. Thank you.
Thank you so much, Prof. And the time was perfect. I was about to lift up my finger to say 1 minute, and you were just done. Thank you very, very much. And thank you very much for also dealing with the multiplier effect, because the big issue is always, oh, but you know, the new manufacturers, their products are too expensive. But we hope that you have, because you have just touched on this issue, that this will be something that will be in the forefront of the minds of those who control purchasing. I would now like to invite for the first panel discussion, which will be on accelerating industrialization of the pharmaceutical sector to achieve healthcare security and inclusive economic growth. First, would like to invite Pharmaceuticals Made in South Africa from MISA Chairman, Dr. Stavros Nicolaou, whom I think needs very little introduction to the stage. I would like to also invite the Honorable Minister of the National Department of Health. Minister, apology, I should have actually invited you first, protocol-wise. Please forgive me. Please come on stage and take a seat. I would also like to invite the DDG from our DTIC, Ambassador Xolelwa Mlumbi Peter. She will be coming through to us online, and I hope she is there. Yes, I'm seeing a nod. Thank you very much. I'd like to also invite the senior advisor to the Africa Secretariat, Mr. Temba Kumalo. He's the senior advisor on regional value chains. Please join us on stage. And to moderate this discussion, I would like to invite my sister, the president of the African Prosperity Fund, Ms. Yavi Madurai. I did not know this, but Ms. Yavi Madurai is one of Africa's 50 most influential women. And it was something that I only discovered last night when I was doing my research for today. So congratulations, and we are so honored. Thank you so much. Apologies. I seem to have missed somebody, but they're not on my list. Oh, sorry, they are. Apologies. So the DDG for Trade, Industry and Competition, Mr. Tebogo Makube, my apologies, sir. Please join us. Thank you very much.
So we're going to add the thorn to all the roses. Good morning. We stand on existing protocols just in the interest of time. In setting the scene for this, as you can imagine, this is going to be a very interesting panel discussion. And in setting the scene, there's a book that has been written. It's in Stavros's office, but when Stavros and I had a conversation way back when about the story of how the vaccine situation got resolved that our brother from Afrexim Bank was talking about in President Orama's speech. There's a part that Stavros tells, a story that he tells, but there's also the part in the book where Stephen Saad, the CEO of Aspen, goes to his executive team and he says to them, and obviously there's craziness happening. Nobody knows what's going on. We don't know if we're going to get vaccines, et cetera, et cetera, et cetera. You know the story. And he says to his executive team, can we do this? And the response is generally blank faces because it's not their normal. It's, they were doing other things as Aspen. And he goes away and he comes back, and there's obviously lots of, in the interest of time, I'm shortening the story. And he comes back and he says to his executive team again, can we do this? And their answer, obviously, was a resounding yes. So I'm going to start off today by saying to all of you in the room, because the power in this room, the decision-making capacity in this room is unprecedented. So I'm going to start off by saying to all of you, can we do this? And I am wanting to fast track you to say, it's not a matter of can, it's a matter of will, and it's a matter of if any of us have anything to be able to do with this. We stand at the crossroads of being able to do something about not the future, as DG Jean Kaseya says, not the future, but today. If ever we found out that we are at a stage where self-reliance that is captured in Agenda 2063 and self-sustainability was ever at a point where we can no longer be talking about something and planning about something and doing more documents than we ever have done before, now is the time for us to do this. With donor funding and donor aid cuts coming, it's a wake-up call, if anything, to say to us, it's time. All those documents, all these reports, all these things that we've been saying and doing in all of this time, now is the time for us to put our money where our mouth is. Now is the time for us to actually deliver on all of the things that we say we want to be able to deliver on. President Ramaphosa, as AU pandemic preparedness response champion, has made calls for regionalized and localized manufacturing to become, in effect, not just for us to be able to talk about how we're going to do it, but when are we going to do it? And with the way things are going, we are at a point where We have to now start putting deadlines in place in order for us to do that. Secondly, and I'm now wearing, I was wearing my Pan-Africanist hat, and now I'm going to wear my South African hat, is that we have the ability in this country to be able to, as President Orama said, as well as SG Wamkele Mene said, and everyone else that has iterated it over the past couple of hours, is that we have the ability in South Africa to be able to start this at least. Obviously, from the rest of the continent, we need to be able to utilize the regionalized value chains that are contained within the AFCFTA agreement, within the context of the AFCFTA. And the AFCFTA is very close to my heart, let alone my head. And so we are at a crossroads to be able to deliver on that self-reliance that we want to. So I ask you to please pay attention to this very important panel. What we discussed today is obviously going to go into the report that Prof. Luongo is going to be putting together, especially from a multiplier effect. And I'm not a health person, I'm a trade economics person. So for me to have wrapped my head around all of the health agenda items has been fascinating, to say the least, in terms of my question constantly is, why aren't we doing this? There's a reason I am part of this initiative in terms of being able to look at it from an African Prosperity Fund perspective, is that we've got to look at innovative financing and innovative ways and means of being able to look at whether we close the gaps in terms of the funding and how we do that, whether it's tax incentives and those kind of things, and how do we now start to access, whether it's sovereign wealth funds and various other processes that we are not necessarily and normally used to in traditional structures. We need to look at innovative financing, innovative investment, and ways of being able to partner and make sure, because as Deputy Minister Pinky Kekana highlighted, this is not an African problem. Africa's problem is a global issue. Otherwise, we wouldn't have received the aid and funding in the first place, if we think about it. So on that note, I'm going to take a seat and welcome my panel. And we'll keep, if we've got time, we'll take questions if we've got time. But I'm very sensitive to the fact that we've got to finish on time. So on that note, I am going to ask Minister Aaron Motsoaledi to please give us a perspective on where we are at when we look at the National Department of Health, when we look at the agenda from a South African perspective, but looking at it under the stewardship of President Ramaphosa's AU Pandemic Preparedness Response Championship call. How do you frame and how do you see us being able to move this agenda forward, and us also making sure that we're not just doing talk, we're actually now going to start to implement, and with your leadership, sir.
Thank you very much, President Director. Thank you, colleagues. Look, there are several things that need to be done to move away from this problem. But I think first of all, we need to have a deep transformation of life on the African continent. Number one, for all leaders in this continent, to realize that health, it's not for me an experience, it's a huge investment. I don't think that is already something or is reflected in the minds of people. That we are not dealing here with the expenditure, we are doing a huge investment for now and even for the future. The second thing is to realize that the economy of any country and the economy of the world and the health of its population are inextricably bound. That also has not yet sunken in, and you see it from behaviors of treasuries. Unfortunately, I'm not talking about the treasury of South Africa. All over, more so on our continent, because we regard financing health as just a social function, not an economic one. I'm arguing so because nobody has ever built economies with sick people. It's not possible. I am saying so because even now in South Africa, with ample examples, you still hear people in business, in the economy, complaining about where are we going to get money to do this and that. The prime example is in 2010, when the country was ravaged by HIV more than any country in the world. We launched the biggest HIV testing and counseling campaign, as you know, which is now the biggest in the world, with 5.5 million people on ARVs, something we are not proud of, but we are happy that we have achieved that. If we didn't, I keep on telling business people, many industries will have collapsed by now. There wouldn't have been any economy in South Africa. But they were asking us questions when we started. Where are you going to get the money from? Where is the money coming from? And I've been refusing to answer that question. Because they were saying, can we do it? And my answer was, can we afford not to do it? Because I meant that if we couldn't do it, then we'll have collapsed. Today, we are talking about universal health coverage, which we call NHI. The same questions come all over and all over again. Now we are talking about local manufacturing. We are now already defeating ourselves, whether we can and all. We have got scientists in this country, world-class scientists. All they need is to be enabled by politicians. And there are three things that must be done urgently. Aligning the WHO pre-qualification with that of individual countries, but also changing our procurement systems. At the moment, out of 54 countries, we only have 8, I'm made to understand, which have got what they call maturity level 3 of manufacturing. 8. Well, that's enough to make a start. But I want to end with something which people say is controversial. My friend there, Dr. Kaseya, who said he must call me Aaron, yes, I accept, because sometimes people bite their tongues with mutwa lady. So I allow that, there's no problem. He likes saying I like rebelling, but these are realities. I raised this issue in 2014 at the meeting of the World Health Organization, Africa region. I raised it again in Victoria Falls in Zimbabwe in 2016. Why are we the only continent in the whole world where when a head of state is sick, they've got to go to another continent to get treatment? How do we achieve this? How do we think the world will take us serious when we don't even trust? Do you know how many heads of state here in this continent went to die outside the country looking for help? Why can't they get help here at home? Then we'll say we're serious about improving healthcare situations here in our continent. I made that proposal to my fellow ministers, and nobody supported me in the meeting, but outside the meeting during tea time. Yes, I got a lot of support, but that resolution was not carried. I repeated the same thing at Victoria Falls, same meeting, Africa region of the World Organization. Please, we are ministers of health. Let's pass a resolution and send a message to our heads of states. Get treated here at home, then you'll appreciate the problems. You'll appreciate what is missing, because you yourself have been there. Of course, again, I didn't get any support in the meeting, but outside again. And that day, it was even bad. The BBC chased me around because President Mugabe had just addressed us, and they were saying I was referring to him. That's how petty it was. I was referring to the whole continent, because up to now, it's still happening. If we are to be taken seriously that let's manufacture locally, let's also be treated locally to show the world that we have confidence in our own systems. And I'm demanding that. Now, Stavros, let me address you, because you are in that sector. You are the only one I know the most, because you are there. You are their rep. At the moment, Africa is still ravaged by malaria. You know that. 94% of all the malaria deaths are still happening on this continent. Like in all the other products, we buy them overseas. One of the most effective ways of the fight against malaria is what we call indoor residual spray with a chemical called DDT. I know many of you will freeze here because we have been made to believe that DDT is the enemy. It has been banned in some countries, yes, but not here. You believe it's an enemy. But I haven't seen a grave caused by DDT. I've seen millions of graves of young children under 5 caused by mosquitoes and malaria. Now, why am I raising this thing? In Africa, where 94% of malaria is, we don't even manufacture a simple chemical like this. It's manufactured in India. And the company manufacturing it has been threatening us for 15 years that they're gonna stop. They are they are threatening again that by the end of this year, we can stop. Let me tell you, when the United Nations Environmental Program in early 2000 banned DDT as a persistent organic pollutant, in South Africa, we stopped using it. Death from malaria increased by a whopping 66%. We had to bring it back in 2000. And who was dying? Pregnant women and children under 5, the most vulnerable. Same thing happened in Namibia. Now, at the moment, we can't even manufacture that stuff. The one we need is not needed in any other country because the other countries, Europe and the US, the West, they've used DDT to get rid of malaria. It's no longer there. So they don't need it. That's why they even ban it, because they are powerful. In other words, they climb up to the top of the roof with a ladder and they kick it away and say Africa must not climb. And we are agreeing by not waking up and do that. So let's start with simple things like that. Manufacture everything we need on this continent. Then we'll support it. Now, unfortunately, on this issue, you are going to ask me a question because we don't have time. I want to answer it now. This is not new, this debate we are having. We're not going through a new debate. Stavros knows more than anybody. I was faced with this debate in 2010 when we launched this Africa's biggest HIV counseling and testing. In 2010, we were targeting to test 15 million people, and those who are positive put them on ARVs. We end up testing 18 million in 18 months and putting people on ARVs until today we have got 5.5. What was the issue? It was led by him. It was led by Stavros from Aspen. He mobilized the trade unions, COSATU especially, and the other people in the sector. They came to union building to say, Minister, you are launching the world's biggest program. You are going to buy ARVs from here, not anywhere outside the continent of, in fact, it was about South Africa at that time. Everything you must buy from South Africa, that money must circulate around here. And of course, COSATU will say, yes, yes, because it will create jobs and all that. Our calculation at that time was that to run such a program, we are going to need 16.5 billion rand. Today we're spending 46.8 in 15 years, but at that time we're going to need that in about 3 years' time. So we call the Minister of Finance and say, here is an issue, we want to buy locally, but our calculation is that if we do so, this amount of money we need. At that time, the Minister of Finance, a very competent minister, was the late Minister Pravin Gordhan. He was called to union building, he remembers. Because I said, call him. And he arrived there, he looked at the figures, he said, sorry, this is not possible. We won't be able to do it. Treasury won't put this amount of money. And what did we do? We took that contract to India. Yes. Yes. We're still doing so even now. So what am I trying to tell you? The South African market, health, DTIC, finance, is a great pity that the Minister of Finance is not here. I saw he was supposed to be in the panel, but you see how busy he is. Let's come together, pharmaceutical in unions. and say, how do we solve this problem? Because in that meeting, all I told COSATU is, you want jobs from our members. I want treatment for everybody who's sick, including our members. And I was not training them, I tell them the truth, that before these jobs are created, your members will be dead. So I need ARVs before jobs, so that when they get health, you create the jobs for them. So those are the choices, yes. And we need to make that choice as a country. Do we buy here, no matter at what cost, or what do we do? So it's not a new debate, it has been there. My own organization took a decision in 2007 that we must establish a state-owned pharmaceuticals, specifically for ARVs. We never were because of issues of pricing. We couldn't. We have not even started, and that's 17 years, 18 years ago, we haven't even started. So unless those problems are solved, these stories we talk here about local manufacturing and all that will just be pipe dreams. We'll just be talking about them in meetings and conferences like this, won't go anywhere. So we need those practical solutions and a change of mind. Thank you.
Thank you, Minister. To have a pipe dream, it cannot be. So how can local, when I say local, Africa, producers align their needs and their capacities themselves to international regulatory standards, amongst other things, in order to be able for us to now start actually building economies? Because that's what we need to do. We need to start being able to deliver on what Minister is saying. You know, this is going to be a pipe dream, and we're going to keep on talking about it. And we've established now we need action, not talk. So how do we do this? How do local manufacturers start to almost unravel the status quo and start being able to look at how we deliver on that?
Okay, Madam Moderator, Yabi, I'm going to also respect all the protocols. I'm aligned with the Minister, let me start there, but I do want to make a very quick prefacing comment first. DG Kaseya made a point earlier around Africa reaching its second independence through health sovereignty. We have to be clear as business people, a business community, that if we do not take investment in healthcare seriously, then we will unfortunately, not if, but when the next pandemic happens, the next outbreak, unnecessary lives and livelihoods will be lost, economies will be affected, and in some cases, economies collapse. We are seeing dramatic donor aid cuts at the moment. As Minister alluded, 2 decades of progress on HIV can be unraveled before our very eyes. DG Kaseya put up a very telling slide in that regard. Okay. I'm prefacing those comments first because the penny needs to drop with the dire situation potentially we find ourselves in. Now, what stands between calamity and the second independence? The common element, the nexus, is our ability to set up and establish local manufacturing capability on the continent. Because in a time of need, many have said this, it's like Hunger Games. If you watch that movie, Hunger Games, it's each man or woman for themselves. We cannot afford that again as a country, as a continent, cannot afford that. So what needs to be done? And I'm going to start segueing from where Minister Motsoaledi left off, because he mentioned some of this already. We need a 3-point plan for Africa. Number one is aligning the WHO pre-qualification with the national regulators, of which there are 8 ML3s, as the Minister mentioned. And here I must commend Dr. Samete, the CEO of SAPRA, because SAPRA has already started the process of joint submission. So in other words, we cannot as Africa sell products unless they are pre-qualified. But we cannot wait for 5 years for them to be pre-qualified. We need this done in 12 months. And that's what Dr. Sameti and WHO are working on, as you mentioned, Minister. That's point number one. Point number two is we need a reform of the international procurement agencies' procurement mechanisms. What am I referencing here? Let me use vaccines as an example. Gavi and UNICEF procure around 55% of Africa's vaccine requirements. But yet, Africa imports 99 plus percent, almost 100% of its vaccine requirements. How can it be, and DG Kasai has mentioned this many times, how can it be that a continent that has the most disproportionate disease burden of any continent imports most of its medical countermeasures? It's like saying you have the biggest car market in the world, but you're importing all your cars. It would never happen, right? So put differently, Africa has outsourced a market of 1.4 billion people, soon to be 2.7 billion by 2050. We have outsourced that to the rest of the world. And then we wonder why we cannot fund our own healthcare programs on the ground. Let's get into our own production, generate our own taxes, we fund our own programs. It's a simple calculation. Third and final point. The continent is working furiously at pooled procurement. So we need to aggregate our volumes, continent. We need to leverage these volumes so we can build economies of scale. The most important thing I can say to you today as an audience is manufacturing is all about economies of scale. This is what Minister Motsoaledi was saying earlier. He's saying it's all well and good having these ideals and these, you called it ambitions earlier, Minister. But if you cannot compete, people will not buy from you. And DG Kasaya makes that point repeatedly. So how do you get economies of scale? First of all, charity starts at home. I'm very pleased that we have got in the audience today Mr. Willie Matabula from the Chief Procurement Officer, from the CPO. He is the man responsible in part for drafting the procurement, the public procurement regulations for South Africa, which is going to solve exactly what the minister was saying. The minister was saying that, of course, everyone wants to support local manufacturing. But when it comes to the crunch, who's going to write the check? Now, these regulations are the ones that are going to, I'm hoping, once and for all, settle that conversation, because we cannot continue having this debate endlessly, and our trade deficit keeps growing, our economies get weaker, our public health programs collapse. So it's a very, very important development. What I hope Mr. Matabule is still here. I hope he'll wave if he's still here. He might have left because he heard I was going to speak. But it's a very important development. And lastly, let me just say that setting up pooled procurement on the continent, which is something, again, that Africa CDC is seized with, to give us those economies of scale is very important. But we do need the international procurement agencies to start buying for Africa from Africa. And here I'm looking specifically at Gavi, UNICEF. UNICEF minister has committed to procurement targets, but they are yet from Africa, they are yet to announce them. So please, next time you meet your UNICEF colleague, ask her, why have they not come out with these targets? We need them in order to succeed. And lastly, can I just say that there is no better investment we will make in our lifetime than if we set up our own manufacturing capabilities and capacities, keep our scientists, keep our manufacturing people on the continent, keep our talent on the continent, and lastly, ensure that we industrialize and give our people on the continent not only better public health, but we grow economies, we create wealth, so that we give our people on the continent a better standard of life. Thanks very much.
Thank you, Stav. Which is a perfect segue, Teboho. DTIC, you are the man all about the Public Procurement Act. So Minister Motsoaledi, Stavros has kind of framed for us that on the one side, there is, and we've all been talking about it, we want to be able to do this. We are faced with certain things that, and when I say certain things, policies, frameworks, budgets, et cetera, in short, that may not necessarily allow us to move forward, which means then that it becomes the whole pipe dream and more talk and less action again. Teboho, give us a sense of what and how can we use the PPA to be able to at least, whether we're able to achieve it, whether we're able to get there, or whether it's a stepping stone in the right direction. What is possible, at least from a South African perspective, bearing in mind DTIC, obviously we're going to move to the AFCFTA just now, but at least from a South African perspective, what can be done? How can it be done? And what could lie ahead in terms of how we innovate in order to be able to make some of this a reality?
Yeah, thank you, Minister. Ladies and gentlemen, good afternoon. Well, just like you, I'm an economist trying to look at the health sector as a market, right?
Yeah.
So what is clear is that health expenditure is equals to 8 to 9% of GDP in South Africa. So
8.5.
8.5. So it's huge amount. And you look at what we top 10 products which we import as a country. Health was number 6, but I look now it's number 7. So it fluctuates between 6 and 7. Now, the whole concept of the multiplier is not positive, right?
Yes.
It's also the negative side of the multiplier effect. What does that mean? It means that health expenditure is also externalized if we rely more on imports, right? So we spend money supporting jobs in other countries. It happens because we don't have capacity in certain areas, but also because of our buying decisions, all right? And how do we then increase aggregate demand, all right, to resolve some of the economic problems that we have in the country? So public procurement plays a role, local production, not only to support the public sector, but the private sector as well plays a role. The other issue that we'll have to look at is regional value chains that we can create, the opportunities in Africa. I've heard since today that the importance of pooling procurement in Africa, but the numbers are indicating that intercontinental trade in pharmaceuticals has dropped, right? So meaning that the African market is being supplied by international markets. Now, from a South African point of view, public procurement plays a very important role. We have designated sectors for including pharmaceutical products for local production. Once we finalize the regulations that will come into back again, we have the master plans of medical devices. You know, the experience that we have learned since the designation, and it's scary, Minister, that the mattresses that are used in the theaters are not produced in South Africa. We import those mattresses. So if we then talk about pharmaceutical products, you know, that's advanced manufacturing. All right, so we have to look at public health as a market, decide on how we are going to resource the inputs there. And we cannot escape local manufacturing. You know, as you know, in economics, the equilibrium, if you don't manufacture, then the imports will fill in the gap. And that creates problem for us. The other issue besides public procurement is to have national champions in the country, all right? So I must not be afraid to support companies like Aspen, Biovex. Supply chain efficiencies are critical in this area. So if you have the SCZs and you agglomerate manufacturers and suppliers, that will also assist us. So let's look at the instruments, and government must agree using public finance, public economics, apply it, public procurement, SCZs, and look at the other input costs that will make sure that we increase our capability. Lastly, is the importance of pharmaceutical manufacturing as part of advanced manufacturing in the country. If you want to play at a level of high value manufacturing, this is an opportunity. So we use the burden of disease not as an handicap, but as an opportunity also to advance as a country. Yeah, thank you.
Thank you, Teboho. This brings us to Kolerwa. Can you hear us?
Yes, I can hear.
Sound? I can't see. Can she? Are you muted? Let's just check.
No, I'm not muted. I can
there we
hear
go.
you.
There we go. There we go.
Okay.
So thank you for joining us. We know that you are in the DRC with AFCFTA Secretariat SG as well, dealing with matters of trade. So, you know, your colleague Teboho put into perspective for us, you know, the Public Procurement Act, the framework from a financial perspective in terms of how can we possibly look at various ways of, even if we're just increasing or progressing or making some kind of progress. From your perspective, in terms of the actual trade agenda, what could you frame for us in terms of how we could now take the steps towards the intra-Africa trade part of it? So, you know, we've got a public procurement perspective in terms of DTIC. When you look at it from a DTIC perspective, how can we start to optimize? You know, the best part about the AFCFTA is the regionalized value chains. For me, that's the best part. For you, from a South African perspective or DTIC, how do you see us being able to start, at least as a country, to be able to drive those regionalized value chains and get us at least 1 or 2 steps further in this action plan that we kind of want to put together and move it forward?
Thank you very much, and greetings to everyone in the room, including Minister Motsoaledi. I think the starting point for us is the fact that Africa has a disease burden, but however, we are not able to produce, as many speakers have indicated, our own pharmaceutical products to meet our own needs. And the question really is, as you have said, what is it that we must do, and how do we leverage intra-Africa trade, including the AFCFTA, to meet our own needs? And I think, as SG Mene had indicated earlier, we really need to use the policy tools that are available to us, including those that are available under the AFCFTA. Importantly, I believe that we need to prioritize the implementation of the AFCFTA so that we are able to overcome the challenge of small fragmented markets, so that we can create the conducive conditions for us to be able to boost continental manufacturing, but also research, as well as use of local content, which was emphasized by the previous speakers. If we look at the continental market, what the AFCFTA does is to remove the trade barriers and to promote intra-Africa trade. We are, under the AFCFTA, removing a number of tariffs that currently inhibit intra-Africa trade. Through this, we'll be able to lower production cost, but also improve greater affordability of medicines. Secondly, we must leverage the AFCFTA to support the development of regional value chains and bring more countries into the pharmaceutical value chains. And as the audience may be aware, the pharma sector has been identified by the AU as one of the priority sectors that we need to leverage to improve trade, economic growth, as well as public health. Thirdly, we must use the AFCFTA to attract more investments into the pharma sector in Africa. Any company that sets their own productive capacity in the continent will be able to leverage, of course, if they meet the requisite rules of origin, will be able to leverage a market of 1.4 billion people, as well as an estimated GDP of over 3.4 trillion. And this is necessary for us to spur innovation and drive economies of scale in terms of pharmaceutical production in Africa. The fourth point is to ensure that we create the right ecosystem that can support the development of the pharmaceutical sector in the continent and be able to lock in those value chains. Through the AFCFTA, we have a protocol on intellectual property rights that supports the development of IP laws at a national level, but also importantly enables the protection of intellectual property rights in a manner that nurtures innovation, but also promotes technology transfer so that we are able to ensure effective responses to the public interest imperatives. The fourth point, which was also emphasized by both Minister Motsoaledi, but also by Stavros, is around the pooling of public procurement. And here, if we are able to create a pooled public procurement, it can assist to promote local production. But importantly, we are looking at also harmonizing regulations that are critical to incentivize production in the continent and also lock in the value chains. And we are starting to see a lot of positive results in this regard through the Africa Medicine Regulatory Harmonization Initiative, which has ensured that we are able to tackle the problem of misaligned regulatory frameworks and address the issue of overpriced medicines, as well as poor access to medicines. And the initiative has already ensured that 4 of the 7 East African National Medicine Regulatory Authorities, as well as 5 of the West African authorities, have also been able to reduce the market approvals down from over a year to 7 to 8 months in the case of East African Community, as well as in the SADC region. But also importantly, Chair, we having this meeting at a time when we are witnessing seismic shifts in global trade that are fragmenting international trade and further disrupting supply chains. To us, this raises the need to prioritize building our regional industrial capabilities, of course, building on the opportunity that is presented by the AFCFTA, but also, I think what is critical, because we see a number of African countries that are now trying to respond to these seismic shifts in terms of looking how to import more from the developed world. What will be important is to really look at how we can collectively take a long-term view around the strategic importance of the continental market and safeguard the existing supply chains that we have and build on those supply chains so that we can ensure a predictable and sustainable market. We can see that other markets elsewhere are not as predictable as we thought. The only predictable market that we have is that of the AFCFTA and that of the continent. And therefore, it is going to be important that in whatever responses that we provide in the context of the current global crisis, we really look at preserving the continental market and the agenda that we've set for ourselves under Agenda 2063. South Africa also recognizes in the context of the G20 the importance of multilateral cooperation to address issues such as global health as well as health security. And in this regard, under the G20 Trade and Investment Working Group, we have put forward a theme on trade and investment agenda to address the issues of the global commons. And here we are hoping that the G20 membership can explore how trade can contribute to equitable production and access to key medical tools that are critical to public health. And we do believe that the experience from the COVID-19 pandemic presents important lessons for all of us, including the need to collectively focus on the diversification of production to ensure better resilience and preparedness for future pandemics. I thank you, Chair.
Thank you, thank you. My brother Temba, AFCFTA, you know, it can be positioned, and I've been told this a million times, that it's not a silver bullet, but we position it as a silver bullet. Whether it is or whether it isn't, we are currently in an era of the AFCFTA. The ability for us as a continent to be able to come together from an economic and trade perspective and solve our own problems. When you look at this, so Koleba put it to us from the perspective of a member state using the AFCFTA. When you look at this from an AFCFTA perspective to all member states, and us looking at it, whether it's a regionalized value chain, whether it is from the perspective of pool procurement, whether it's from various perspectives, where and how can we start to actually use the AFCFTA operationally, implementably, actionably, in order to start driving the plan, the agenda that we have, that we've put forward today?
And thank you very much. And once again, good afternoon, Minister, Deputy Minister DG, and colleagues. Maybe the first point to make is that the AFCFTA Secretariat is a member state-driven organization.
Yes.
So the primary mandate is to coordinate the implementation on behalf of state parties. And maybe for those that may obviously not be aware, we, out of the 55 members of the African Union, we have 54 signatures. We have 49 ratifications, which obviously, as it was indicated earlier on, you can never ask for more political will than what we have in as far as that is concerned. We are sitting at 22 countries that have gazetted their provisional schedules of tariff concession. So meaning countries that are ready to trade on AFCFTA terms as in date. We looked from the AFCFTA Secretariat, we looked at the prioritization of pharmaceuticals, obviously on the basis of what data was telling us. One, on the import basket in terms of how much we are importing, but critical to it was the ability to produce the same type of goods that we are importing, because otherwise it would not have made sense for us to want to prioritize it. We have got 4 areas that we're looking at. It's pharmaceuticals, it's automotives, as you are aware, we still continue to import a high number of second-hand vehicles. It's agriculture and agro-processing. The food bill is huge. And lastly, which is also critical to this conversation, is transport and logistics. We remain uncompetitive because of how much it costs to move, not just a finished good, but an input into production. It's still a huge issue. We have partnered with an organization called Trademark Africa. It used to be Trademark East Africa, because as you're aware, if you look at our regional economic communities, probably the most integrated REC is East Africa, on the basis of the work that they've been doing over the years. We are prioritizing key trade corridors to see how we can be able to help modernize systems in those. For an example, Abidjan to Lagos corridor. Cote d'Ivoire being a French-speaking country, you go to Ghana, being an English-speaking country, go to Togo, being a French-speaking country, you go to Benin, a French-speaking country, you go to Nigeria, an English-speaking country. All those customs systems do not talk to each other. and yet you expect your goods to move seamlessly in a manner that helps to reduce the cost, not just of exporting the product, but it negatively impacts on ability to actually be able to produce at a competitive price. So on top of what Ambassador Tolera just referred to, we are looking at those issues and saying, from a trade policy support, how do we ensure that even at the usage of the African pooled procurement mechanism, we can be able to support that, so that where there's production, we can then be able to move the goods across the continent. We are supportive to the work that AMRH has been doing, obviously, that AMA will continue to do, because key to it is about harmonization of regulation standards, which the AFCFTA agreement provides for. And we have a full dedicated team in the office that is engaging with AU agencies to ensure that we can be able to attend to that matter. I think part of what the Secretary General continues to say, we should be able to leverage on these economies of scale provided by the FCFTA to justify these investments, which are not new investments we have been talking about. It's old stuff, but we have never had this instrument that therefore brings in these 49 state parties together and say, today you can be able to produce in South Africa and trade in Kenya on the same rules. Because we have defined the rules. When we talk about, I mean, there's always rules of origin. Put differently, the local content that should be able to define a product that this is locally made is our intel, because that's where industrialization is. So we want to make sure that where we are producing whatever priority product, that it can be able to meet those rules of origin, because it enables us to see that we are industrializing the continent through this procurement. And it's our biggest focus. There's an investment protocol with some of the issues that are being attended to, but through that investment protocol of the FCFTA says to the business community, when you invest in the continent, in the 49 state parties, and obviously we're hoping to increase those, is that your investment is protected in the continent. You can invest in Ghana and trade in Egypt. And I guess maybe due to time issues, maybe let me end there.
Thank you, Themba. I am going to get looks from Lwazi at any second. She's going to start to give me looks. So, gentleman and lady, in terms of your closing remarks, now, before our panel, Professor Luongo, who is our research partner from United Nations for Peace University, spoke about the report that we're going to be doing, in terms of this whole initiative. I would like for us to be able, as an outcome of this particular panel, I need one thing from each of you. I only want one thing. Only want one thing. One thing that you, as an individual, not necessarily your organization, or it could be your organization, that we can put into the report to say, this is the lever. This is something we're going to commit to doing. It can be the smallest thing. It can be the biggest thing. We need to start actioning. So one thing, if I may ask from each of you to say, you're going to be doing this, and I'm going to come back in a couple of months when the report is done, and I'm going to go, you said, can we now start to talk about this? So, can I ask, I'll start with Madame that is in DRC. Kolerwa, can you hear us?
Yes, I can hear you.
There we go. Can I start with you ladies first?
Okay. I think one thing that we must do really is to preserve, especially in the context of the global headwinds, preserve continental supply chains when it comes to pharmaceutical products, so that we can boost intra-Africa trade and use those existing value chains as the basis to build regional value chains that can assist to boost local manufacturing in Africa. Thank you.
Thank you. Minister, I'm going to come to you last because I want you to put the cherry on the top, if you don't mind. Temba, can I come to you next? And you know, my brother, I'm gonna come. I'm gonna come.
I think for me is and I'm happy that the DG facility is here. And through the African Vaccine Manufacturing Accelerator, where we are attracting investments for local production, let's be deliberate about having to buy from those investments. I know it's always a price issue, security of supply, but we have to start somewhere.
Exactly.
Can we attract investments and procure deliberately by the state, by the cooperation or collaboration at the African Union? Otherwise, there's no need for this conversation.
I agree with you 100%. Tebogo?
Well, quickly addressing tax incentives, offtake contracts, and triple Ps in the sector.
I love Tebogo the most. 3 things, 2 seconds. Thank you. That says a lot. It's huge. Staff?
Four things, four words, okay? The first word is implement. Stop talking and implement.
Yes.
Number 2 is market demand, sustainability. Number 3 is international procurement agencies. You've committed to targets, meet the targets, buy from Africa. My last point is let's buy from Africa for Africa.
Made by Africans.
Yeah.
Yes.
Correct.
Thank you, Stav. Minister, the cherry on the top.
Yeah, look, I think each country on the continent has got its particular strength from which the others can gain. And that's not what's happening on the continent. If you ask me, I as an individual, where I will start, there's no manufacturer of ARVs in the whole world who doesn't want to do business with South Africa. There is none. That is where I want us to start. Because Dr. Kasaya told me that there are 27 million people who are on ARVs on this continent, but they are all bought outside the continent. So we can start looking inside and start with ourselves because of economies of scale. I know you said you must summarize, but sitting in this position, you see a lot of things. There is something I forgot to mention to you, which completely surprised and disappointed me. When I arrived in Home Affairs from Health, I found that in South Africa, we have got a huge government printing works where we print all security documents. Anything that needs security, we can print it. And you know what I discovered? That on this continent, if you want to know which country was colonized by which one in Europe, you check where they print their security documents. I'm not going to mention names, but just visit all the countries in the continent, ask each one where they print their security document, then you'll know who colonized them before. And we say colonialism is over, but we're still doing that to each other. Now, I invited a minister from a neighboring country here to visit our government printing works. You know what he said? After I took him through, he said, never ever in my life did I dream that there is such a facility on the African continent. I thought all these facilities are in Europe. So we do have, yes, things that we can share with each other and say, this country is good at it. And I thought AFCTF is about that. Yes. Which country is good in what, so that we all go there.
Yes.
And which other country, you know, so that
Yes.
we, yeah. But at the moment, we don't trust each other. We don't even have confidence in each other. We still have confidence in our colonizers. That's a problem. And so we need to start there and say, how do we trust each other and see our different strengths, how they help the continent? Then we'll be somewhere. And I'm starting with ARVs. I'm prepared. Show me a country on the continent that is producing enough ARV, or inside South Africa itself, Aspen,
Yes. Then I'll start there because I know we are the strongest in that area in terms of economies of scale. Thank you.
Touche. Thank you, Minister. Thank you so much to my esteemed panel. And I'm going to hand over to Lewazi. My 3 words is something I live by professionally in terms of exactly what we do. And it's 3 little words for the African continent: trade, not aid. Thank you.
Yep. Ah.
There's no time.
There's a question.
Oh,
Okay.
yes. Start from the beginning.
And also, I am happy to first to say good afternoon. Thank you, Excellency, and thank you for also to invite me. When I come here and I see the brand of G20, we have now 350 meetings until November. We finish almost maybe 40% if Zain is here. And what I heard today, I think we discussed it in the, also during COVID-19. I was here. I looked for 1 year until Emirates allowed to come here and take us back home. My question, Comrade and Excellency, why now we are thinking about vaccine and we are talking about it 2 years ago now? And all these thing has been given to Africa continent. It was like laboratory to only fill. They bring the fill and the dust and they fill it. And after COVID-19, we don't hear about anything about vaccine or medicine or waiting for another crisis. I think the capability is there in terms of, in Africa. But the thing make me worried that until now, not all the country agreed to procurement, what I understand. And second, if they are going to be new rules for each country or lift them up to be all the continent, 53 countries in one system, I think the continent is not in one system. Somebody with the French, somebody with the British, somebody with America, somebody with Russia. And the bargaining for procurement, I think it will be the challenge. Look to this one because we face it in some of continent. Thank you.
In summary, what's the question? No, what is the question in summary? I listen because there are a lot of things. Just summarize what the question is. And I suspect you're asking me, not the
Yes.
other members of the panel.
Yes.
Yeah, what is the question?
The questions only will react when the problems happen. Now I think because EGWA and American cutting resources, that is now we wake up like, COVID-19 overnight. When we see our mommy, our children dying, everybody feel, they have idea and they want to take it to African Union or Arab League and so on. So that means we are in crisis.
Yeah. My answer will be, we can't let a crisis go by. We can't let it go to waste. We can't. COVID-19 was a crisis that opened our minds. It opened us. Aspen was given the opportunity to manufacture the vaccines for COVID-19. But because we didn't have this dialogue here, it collapsed because there was no market. There was nobody who was prepared to buy because everybody wanted to do things in the way they were doing in the past. So it's a crisis that we don't want to waste. And that's why when Stavros spoke, he said, it's not if, it's when the next pandemic comes. So we are preparing for the next pandemic so that we don't become as weak as we were during COVID. It caught us off guard because nobody prepared for it. But surely we must prepare for that. WHO has actually given it a name. They call it what, pathogen X. Yes, it's pathogen X, meaning we are already waiting for it. We don't know its name yet, but we know it's there. That's why they call it pathogen X. And we also know that it is coming because of three things. Number one is climate change. There's no question about the fact that climate change is going to bring some pathogen we have never seen before or we have never heard of, which will be a pandemic. That's number one. Number two is antimicrobial resistance, where we have become so careless with the use of antibiotics. We are now experiencing resistance in agriculture, in health, in environment. So we know something's going to be produced. Number three, because human beings are encroaching on the habitats of other organisms. That's why we're having so many zoonotic diseases now, which I'm sure you're aware that's how Ebola started. We just tampered with monkeys. Yes, next to the Ebola river in the DRC, we tampered with monkeys. And here we are having a pandemic that is difficult to control. So many of them are still coming. We better be ready. And that this session here, we're trying to make sure that we are not caught off guard again. Thank you.
Thank you very much, Minister, and to the distinguished panelists. Please take the floor. And Minister, we really appreciate your answer and thank you for your question, Ambassador. And while the panelists are walking off the floor, I just want to say that this is why these forums become really, really critical, because I can assure you that our heads of state and government, our ministers, have actually been dealing with this matter since COVID in various fora, but perhaps within the AU, and to open it up to the G20 and perhaps to other fora is very, very critical so that we can conscientize everybody to the fact that we are in fact having this conversation. It's been an ongoing conversation. So it's not something that we suddenly woke up a couple of months ago and said, oh, we've got to have this meeting. No, this conversation is emanating out of very many decisions that have been undertaken through various heads of state that have taken on championships, including our own. And it's been happening since the COVID-19 pandemic. I think DG touched on some of them. We could have maybe gone through some more of those decisions, but we are grateful to have this opportunity to actually throw it out to a wider audience. So as you can see, I bought my computer now, so I'm not going to miss any names. I'm not reading from my cell phone. I can see all the names. And so I would like to invite the next panel to come on stage. We will start with the CEO of the Health Professions Council of South Africa, Dr. Makhume Maseke. Please make your way to the stage. The CEO of the South African Health Products Regulatory Authority, Dr. Boitumelo Semete. Please make your way to the stage. We also have the DG of the Department of Science, Technology and Innovation, Ms. Guguzwane. You may come on stage, ma'am. We are joined online by Dr. Jiki Dong, who is from the World Health Organization, and she's the unit head of the Local Production and Assistance Unit. And just to congratulate also Dr. Dong and her colleagues for a very successful World Local Production Forum.
Thank you.
Oh, okay.
Thank you so much.
Get yourselves mic'd up as quickly as possible, and then join us on stage. We are also joined by Distinguished Professor and Director of Infectious Diseases and Oncology at WITS, Professor Glenda Gray, who was also the President of the Medical Research Council. So what I'm going to do is I'm going to ask the moderator, who is Special Advisor to the DG of Africa CDC, Ms. Chanel Hall, to come on stage. And while they're miking up, you can take the opportunity to frame the discussion that's coming up. Thank you very much. Thank you.
So I have shortened my introductory framing, so I hope that the mics get connected quickly. But to start, thank you, sincere thanks to our host, the South African government, excellencies and colleagues, all protocols observed. To frame this session, I will share a few thoughts since so much has been said. There's a Hollywood movie that has a famous concluding line that summarizes in a simple way how to get things done. And the quote is, "If you build it, they will come." But as we have heard today, it is not the case for African manufacturers of health products. It is simply not that simple. And one of the reasons is because African manufacturers have the tough job of displacing the current long-standing manufacturers. And given the philanthropic investment, the commercial investments, the years of sales, the profits accumulated, the ability to compete with whatever price is needed almost because they have achieved, as Stavros referred to, economies of scale, the African pharmaceutical sector is in a tough situation. Demand is one issue that we hear the most concern expressed by manufacturers. It is also the one that they least control. The African pooled procurement mechanism will have major impact. We will drive African demand to African manufacturers. But we want visibility on all actions that are needed to ensure that no African health manufacturing capacity sits idle and that no volumes are left in stock. Of course, we need the African manufacturers and the African industry to match this commitment with quality products and affordable prices. We also have to acknowledge until they get volumes, economies of scale, affordable prices, and competing with international manufacturers is going to be tough. We will hear from the panel on different actions and different segments and sectors that can turn the unprecedented political will into driving change. And from this, we can draw insights on what we need from the powerful advocacy and decision-making of the G20. This effort is not passive, as we've heard. It's shaped by policy, it's driven by decisions made on a daily basis, including procurement decisions. It's enabled by financing, and it's underpinned by belief. So let's get started with our esteemed panel to understand actions that are needed. Okay, so we're going to start with health workforce. Yeah. Health workforce and local production and the pharmaceutical sector are deeply connected. Dr. Mogomi, could you please tell us what is happening in the workforce and how it can be a driving factor for the pharmaceutical industry and for us, the continent, to achieve our goals?
Many of them. We are far below par as required by the World Health Organization. We've got a 0.8 per thousand of health professionals in South Africa. That's very little. But the point is that you don't just need them, you need qualified ones. You don't just need them in big cities, you also need the distribution to make sure that access to healthcare for everybody in our country. So what you need is to say, what are the incentives that we must get for people to go rural so that access to healthcare, equitable healthcare, is accessible to everybody, which is not the case now. So are we training enough? The answer is yes. Are we planning enough? The answer is no. We at the moment are unable to even employ others. So we produced and then we ran short of budget. Now, a good plan is a plan where when you do a formulation of the plan, you also have an implementation plan. You plan for X amount, but you know that you'll employ X amount and this is the money to do it, so that you have the whole spectrum of the planning system put in place so that you are not caught. So in one person, we expect oratory, we expect leadership for our people to be able to articulate the value proposition. We also expect thinking of what the future looks like. Wild thinking results in wild work. You know, it's not out of the blue. People must think deeply to plan and be able to execute the plan. We take it further. It is not just the oratory and the thinking, but it's also an action plan. As you speak to us as an orator who has thought, you also have a plan to put into place to say these are the areas where we think we need them. These are the areas where we're going to deploy them. I can say to you that from a health profession's perspective, there are certain things that we do that we expect from the product that comes out of medical schools. We expect them to be leaders, change agents. So they must lead and articulate the value propositions of the communities. We also expect them to communicate the messages, not only just to the patients, but to people out there as well. We expect them to be scholars. We don't want health professionals who don't read. That's why we've got CPDs. They don't like us today because we tell them, you don't have enough CPDs, you're not going to continue. That is the quality of people, of health professionals we expect, and that's a distribution, equitable distribution in the country. Thank you very much.
Wonderful. Thank you, Dr. Mogome. Dr. Botumelo, we know that health products are one of the more regulated products that exist in societies. The work of regulators helps make sure medicines are safe and effective. It's also one of the more complex aspects of the pharmaceutical industry. So we would love to hear from you about your work, but also about the emerging AMA and how this is going to be such a contributing factor to the continent. Thanks.
Thank you for the opportunity to be here and to be part of these discussions. So, you know, as I was preparing for today, I thought of how pre-COVID, many of us saw regulation as a barrier, right? But like the crisis we're facing now, many of us regulators did not put that crisis into it. We got together and we said, how do we ensure that we enable? When you look at the sub-provision, it indicates that we want to be an enabler. If you look at the strategies of the UK MHRA, similarly, they want to be an enabler. So globally, you are seeing a shift wherein regulators say we want to enable, but also we will continue to be policing, right? Because that's fundamental to how we operate. And so it is important that we start to see the regulator as an enabler. And why do you need a regulator and a strong regulator? Because you want to have a pharmaceutical sector, health product sector that others can trust. We spoke earlier, many speakers spoke around how they want to export their products. You can only do so when the receiving market knows that you're bringing a product that is quality, safe, and effective. We also need it for the safety of our public. We've seen recently a number of products that are emerging that are substandard and falsified. You need regulators to step in and assist them. And then thirdly, you need us to grow the sector. Without a strong regulator, we can do as much as we want to do on the continent. However, the sector is not going to grow. And so as we engage on these conversations about making sure that Africa is sustainable, that there's sustainable solutions, there's equitable access to solutions, and there's solidarity, we need to ensure that our governments invest in strong regulatory systems. And for three core reasons. Firstly, that you need to have an integrated, strong, well-functioning regulator. We now on the continent have about 8 that have been ascertained by WHO through their global benchmarking tool to be at ML3. But also, I think the minister spoke about trust earlier. Someone spoke about trust. To demonstrate that we are starting to work towards building that trust, we've entered into an MOU, all 8 of us, as DG Kaseya has said, wherein we say, for many, many years, we've been relying on the WHO, we've been relying on the US FDA, relying on European Medicine Agency. But we now have the capacity as African NRAs, and this MOU demonstrates that we want to trust each other, and we will now start relying on each other. So if Ghana has reviewed a malaria vaccine, South Africa is not going to go into a full assessment. We will rely on the work that Ghana has done because they've been assessed and we trust the work that they do. Thirdly, it's important that we have harmonized requirements. As many have said, you want global continental access to these products.
But we've listened. Industry has said to us they don't want to submit a separate dossier across all 55 member states on the continent. And so we have regional mechanisms with harmonized requirements. And about a few weeks ago, we ran a continental process where, and this lays the foundation for ARMA, and I'll reflect on ARMA later on. But through this process, we put out an expression of interest. We received applications from multinational innovator companies, and we worked with our own assessors, our own African assessors. We did full reviews of vaccines and monoclonal antibodies. And about 2 weeks ago, we have what we call a continental listing, the first of its kind. So now as Africa, we have products, 3 vaccines, 2 monoclonal antibodies that we've assessed ourselves and we have listed them. What does that mean? It means that every other country then, all 55 of us, when we then receive those in country, it will only take us 90 days at a country level to then register those products. That's game changing. And this demonstrates that regulators are not sitting behind. We have heard. We see the challenges that we're facing. We're engaging with our respective stakeholders. Thank you to Africa CDC, ARDA, NEPAD, et cetera, who supported us, that we're able to do this work. And then lastly, I want to just highlight the importance of, building capacity. CEO speaks about capacity in the health workforce. But similarly, you need capacity in the regulatory health force to ensure that you can have timeous and effective regulatory systems. But also you need such depth of capacity so that all these innovative products that are being manufactured locally or manufactured elsewhere, we have the capacity ourselves to evaluate them and say we are confident of their safety, quality, and efficacy.
Wonderful. You have us excited about regulations. This isn't easy. Ms. Gugu-Swain, if we switch gears to research and development, South Africa is known as one of the largest and best medical research focals in the world. And we know that R&D is so critical for the pharmaceutical industry, but also just for the health of the continent. Could you talk to us about what is happening in the area of R&D that's critical for us to know regarding the continental objectives of not only health security, but health sovereignty?
Good afternoon, everyone. I think we start from acknowledging what we have as a country in terms of, I think Minister just said when he was sitting here, every country has its own strengths. So I think from the South African perspective, we understand that we have a very well-developed industry, though we acknowledge that it needs to be improved. We have a skilled workforce and a high level of research expertise. So out of that, we just need to expand. How so? We've realized that we need partnerships. I think everybody has spoken about that in terms of what we need to do at country level. As you see it from a policy making perspective, you then realize that as much as you can make policies, you need all your stakeholders to be part of those as well. So that's what we've been working on mainly as a department. Ambassador here said nothing has happened since COVID. We seem to be reactive, but there has been work going on behind the scenes, which also would include our stakeholders such as CEO here, SAPRA, and we've been working together with them. But just to give it a breakdown in terms of what we've been working on, understanding as well that we keep on getting the financial constraints that are a problem. It's not just at a continental level or even at a country level where we've seen the reduction of aid or the cancellation thereof, but also our own fiscus is constrained. So we have been investing in R&D, continuing to try and use what we have, but to the best of our ability in terms of stretching and working with our own science councils. We are also very much into capacity building for local manufacturing, particularly looking at the active pharmaceutical ingredients, working with the role players in that regard. If we are talking about pharmaceutical, capacity building, we're looking at building end-to-end manufacturing capabilities and providing technical support, which we would like that it meets international quality standards. I think that has been said before. The department is also part of what we call the Presidential Health Compact Interdepartmental Committee, which is working with everybody that has spoken around the preferential procurement that we need to deal with. Even last week, Tuesday, we had the president visiting the CSIR, and he did say that one of our biggest constraints was this procurement policy that we have currently, and it needed to change. And that was a very promising utterance from the highest office of the country. We do, however, at the moment are working with a number of partners, but also realizing that as a country, you need to have your own strategy, which will direct. I think CEO here is talking about regulation. Part of having our own strategy as a country in terms of vaccine innovation and manufacturing is ensuring that everything is regulated in terms of what we do. So in a nutshell, this is what we've been busy with so far. There are still issues of governance. We're still seeking expert opinion in the drafts that we have, and we are going to be involving a number of people, some of whom are in this room as we move forward. Thanks.
Wonderful. Thank you so much. And it's, I think we've heard from so many. Yes, let's clap. We've heard from so many different voices calling for procurement policy that gives a preference for not only national but continental work from manufacturers and also researchers and developers. So thank you for that. Ji Sui, welcome. Thank you for joining us. I think you're in Geneva, but I'm not sure. We will let you tell us. But I don't know if you were able to hear some of the prior panel, but there have been calls for support to the continental agenda and vision from global actors. And obviously WHO has such an important role in the pharmaceutical industry. And well, congratulations on the World Local Production Forum that you just hosted last week in Abu Dhabi. That was a great success. And thank you, Ambassador, for hosting. But we would love to hear from you what WHO is thinking in terms of practical ways to commit to the continental agenda. Thank you.
Thank you, Chair, and honorable ministers, distinguished leaders, WHO representative to South Africa, Dr. El Halabi, and dear colleagues and friends. First, let me thank you for the very kind invitation to this important discussion. I apologize for not being able to join you all in person. So WHO has been working very closely with African countries, African CDCs, and other partners to strengthen local production using a holistic, ecosystem-wide approach. So this support could be grouped into three big categories. The first one is global coordination and partnerships. So in 2018, WHO led the development and launch the first interagency statements, which was signed by the top leadership of 5 UN agencies and the Global Fund, demonstrating our collective commitment to strengthening local production to improve access. In 2021, the WHA unanimously adopted the resolution WHA 74.6 on strengthening local production, with over 100 member states co-sponsoring it. This unprecedented level of support from our member states reflected that member states strongly recognize how important local production is for the public health. In 2021, WHO established the World Local Production Forum, a sustainable platform for the global community to shape the strategy and direction, foster coordination and synergy, and catalyze collective action in promoting local production. To address the global need for the workforce development, the WHO Biomanufacturing Workforce Training Initiative was established in 2023 with 3 complementary pillars. And since the launch, more than 7,000 staff from manufacturers and NRAs has been trained, with over 1/3 from our African countries. The second category is WHO provides support to countries, particularly to our African regions, in local production and technology transfer. We support the ecosystem assessment. And WHO developed a digital tool to assess local production ecosystems and generate data for countries to prioritize their actions and develop holistic strategies and a roadmap. We also provide support to facilitate the technology transfer and absorption. The famous mRNA Technology Transfer Program was established in 2021 to support the dissemination of mRNA technology in low-middle income countries. And the private sector, we believe, plays a key role in strengthening local production. This is why WHO, in collaboration with the African CDC and the European Commission, organized the annual private sector engagement forum with support from GIZ and BMZ. We also host technology transfer meetings to promote partnerships in technology sharing, financing, and innovation to encourage greater collaboration with the private sector. And third category is what we have been actively provide support to manufacturers to speed up the process to meet the WHO pre-qualification or emergency use listing requirements. Tailored technical support is provided to help manufacturers to be in line with current GMP standards, quality, prepared dossiers, among others. So we have been providing such support to manufacturers for different product types like vaccines, medicines, IVDs, and other products. So in addition to the above, WHO also provides support to the regulatory agencies to strengthen their functions and capacity, and also promote harmonizations. Congratulations to our continent. So far, 8 national regulatory agencies from African continents have achieved WHO maturity level 3. So I stop here and I'm happy to continue our discussion. Thank you, Chair.
Thank you so much, yes, let's give her a round of applause. Thank you, and thank you to WHO for supporting African leadership's agenda for Africa. Okay, so our last panelist, Professor Glinda. I think we have heard through some of the ODA, or that some of the ODA cuts are also affecting research. And it's so critical to the agenda. We would really like to hear from you what is top of mind in terms of how big of a risk does this pose? What are mitigations? What are the way forward? Thank you.
Thanks very much. So I'm going to answer this question in 2 ways. The Minister of Health spoke about the importance of health, not only as an expenditure, but as its relationship to economic growth. But I want to go even further and say that science on our African continent is not a luxury. There's a direct relationship between science and innovation and GDP. And to ignore investing in science is to ignore, is to continue our reliance on colonization. So we have to address that. And we know that science is chronically underinvested in the African continent. So let's just go to globally, the global R&D spend for the global R&D spend as a proportion of GDP is around 2.6% at a global level. South Africa, it's about 0.62% if we're lucky. South Korea spends around 5%, and Germany and Brazil around 3.5%, Egypt 1%, and Japan around 3%. So clearly, at a continental level, we're completely underinvesting in research and R&D. And we can talk about the downstream things like manufacturing and vaccine production, but if we don't talk about the upstream things around discovery and innovation, we lose the whole value chain that we speak about, end-to-end production. And so if we are interested in growing our economy, we have to grow our scientists. And now this is a big problem. So we heard about 15% of the world's population, a quarter of the global burden of disease, and yet we only produce about 2% of the world's research output. So clearly there's a complete mismatch, and we're completely missing in action when it comes to research. We have a chronic underdevelopment and underinvestment, both from the global, which only spends 1% in Africa, and from our own governments. And this translates to, if we have a look at how many researchers we have per million in our continent. So we have about 198 researchers per million in our continent. Chile, as a country by itself, has over 428. And if you have a look at the UK or the USA, they have over 4,000 per million. So to get right to where the rest of the world is, we need to inject another 10 million researchers onto our continent. So we've got a lot of work to do. The minister, when he was the Minister of Health in the beginning, when he heard about the lack of clinician scientists, he created a program where he wanted to fund 100 clinician scientists a year, so that at the end of 10 years, there would be 1,000. And that stalled. Priorities move on and people get worried about other things. And so our investment in R&D doesn't take into account the urgency. If we look at other countries at a global level, if you look at South Korea in the mid-20th century, they were one of the poorest countries in the world. They're now leading in innovation, as you can see with Samsung and LG. If you look at China, you look at Brazil, you look at India, you even look at Rwanda that has made an investment in R&D. South Africa has a very ambitious decadal plan, which really emphasizes the need for innovation and understands the value of medical production and the importance of manufacturing in the pharmaceutical area. And if we pay tribute to the DSI plan, we could work ourselves out of this problem. And so we have a lot of work to do and a lot of reflection, and we have to also get our countries to commit not only to spending in health, but also into R&D. So what about the current problem that we face now with the lack of development and funding, and what are we going to do? We have to understand that South Africa and Africa is very important in global security and answering the questions of the world. If it wasn't for South African researchers, we wouldn't know that you have to start children with HIV, their treatment immediately. So we show that you could reduce mortality at a global level by 2/3 by just doing a study in Soweto. We know from South African science that nurses can treat people living with HIV as good as doctors. And if we didn't know that from the data coming out of South Africa, we wouldn't have done task shifting. Also, we haven't been, if it wasn't for South African scientists, we wouldn't have been able to understand how to control pediatric HIV or anything or any other areas. So we have to understand that the kind of capability is unparalleled on this on this continent when it comes to South Africa. And so we have to, as South African economy and as a South African government, we have to find ways of making sure that we maintain this innovation, even the upstream and discovery things, because that's important to our economy and to growing the scientific agenda on our continent. And so we do need to find ways, diplomatic channels, to retain and save the research that we do on our continent. We need, whenever we do a trade deal with any country, it should always involve funding for research and innovation. That should be unquestionable, and we should do this with all our negotiations. And obviously, we need to look at new ways of funding research and finding ways of making sure that Africa as a continent thrives when it comes to science, and that we are one day like South Korea and like China and like India as a continent. Thank you very much.
Wonderful. Thank you so much. And thank you for bringing data to illustrate the situation, and also for giving us a bit of a roadmap on what would be possible. And I think these messages are going to be very important for us to look at conveying in the messages that will work its way up to the G20. Okay, so now I guess we're going into our lightning round, as we could call it, or we're not doing our lightning round. Okay, we're not doing the one word. All right, so then let us thank our panel for your wonderful insight, and back over to you. Thank you.
Thank you so much, the panelists. I'm very, very sorry to have to cut the session, but we are so grateful for the excellent insights. Just one last thing that I wanted to reflect on, just to pick up on Dr. Gray's comments. She reminded me of something that I'd read a couple of years ago, and I'll just quickly just read from it now. And that is that in terms of research and development expenditure, as well as technology, trade, and investment. This research paper, which was written in 2010 on the SSRN Electronic Journal, found that it actually contributed to 2/3 of the total economic growth. The total economic growth can be explained jointly by the introduction of these two variables, and they looked at a number of OECD countries. And in the case of America, between 1950 and 1995, it contributed to 80% of economic growth in the US. So just to reiterate the point that investing in R&D, tech, of course, this is obviously broadly, but investing in R&D and tech is very much an economic driver. So now to close out the session, I'm going to invite back Yavi Madurai, and she is going to read to us the draft text that's going to hopefully land inside the G20 declaration. And then straight afterwards, Yavi, if you can invite Stavros to please close us off. And thank you so much for your patience as we've tried to get this program to a close. Thank you very much.
So I think we want to get you to lunch very quickly, considering we're running so grossly over time. But just to say to you that the participants in terms of today's event and the speakers and all of that is that this is not just about talk, this is about action. And as part of that, we have endeavored to present a declaration, a G20 declaration to the various, the finance and the working group. So that would have been read by and delivered by Minister Maropeng Ramagopa of the Department of Planning, Monitoring and Evaluation. Unfortunately, we've run so much over time. She's at another G20 event in Cape Town, so she was going to join us virtually, but she's now about to get on a plane, so I am it. So let me just start by putting it into perspective, is that the G20 high-level ministerial dialogue on AFCFTA-led industrialization of Africa's pharmaceutical sector for healthcare security, held on 14 April 2025, So it will obviously become at some point the Santon Declaration. And it starts, in the wake of significant donor aid reductions and funding cuts, Africa stands at a critical crossroads with consequences that extend beyond the continent, threatening global health security. The recent pandemics from COVID-19 to Mpox laid bare the deep vulnerabilities created by our continent's lack of manufacturing capacity and inconsistent demand for locally produced medical products. These gaps cost lives and livelihoods. They are reminders too costly to ignore. This moment must serve as a turning point, a call to action. It is time to reduce dependency on donor aid and instead foster strategic partnerships that advance Africa's self-sufficiency, particularly in the production of medical countermeasures. Doing so will secure not only supply chains, but the very future of Africa's healthcare security. The dialogue was convened to accelerate ongoing efforts in localized and regionalized manufacturing across the full spectrum of medical countermeasures. Central to this is the development of a partnership-driven framework under the leadership of key African institutions, namely the Africa CDC and the AFCFTA Secretariat and their leadership. This initiative aims to support and empower African governments to procure African-made pharmaceuticals, medical countermeasures, and medical devices. From this pivotal session, 3 clear recommendations emerged. Urgently implement existing policies and plans to fast-track Africa's capacity to independently produce pharmaceuticals, vaccines, and other essential medical countermeasures. Align and leverage the mandates of the AFCFTA and Africa CDC to establish a continent-wide pool procurement mechanism and advance alternative financing models and innovative solutions to mitigate the impact of donor aid cutbacks on African health systems. These recommendations are hereby presented to both the finance and health work streams within the G20 technical working groups, and we urge their consideration, further discussion, and eventual endorsement with the aim of securing their inclusion in the G20 Leaders' Declaration ends. On that note, Stavros, I'd like to invite you to just do the vote of thanks and closing remarks.
Thanks very much, Yavi. I'm not going to stand between lunch and yourself, so I would have needed about 10 or 15 minutes to appropriately thank everyone. I'm going to take about 30 seconds. Firstly, let me, there's a lot that goes on behind the scenes in putting an event like this together, I can assure you, and you still hit all the hiccups, despite all the dry runs and the test runs and all of that this morning. We still got bitten by the tech bug, unfortunately. So when DG said there's risks of infections, one of them was the tech bug, Chanel. So let me firstly thank our dignitaries, starting with the Honorable Minister of Health, Dr. Motsoaledi, the Deputy Minister from this department, Public Services and Administration, who were the host today, Deputy Minister Pinky Kekana. Let me thank Minister Maropene Ramachapa, who unfortunately had a hard stop at 2. Yavi did a great job reading out the statement that will feed into the 2 tracks, the 2 tracks being the G20 finance track and the G20 health track. And as she indicated, the intention is that this eventually finds expression in the Heads of State Declaration. So this was a very important meeting, because if we do land in the Heads of State Declaration, it's quite an achievement. It's a very important achievement in achieving health equity on the continent. Let me also thank all the excellencies, ambassadors, and high commissioners that attended here today. We had almost all the G20 countries represented here, which is fantastic and much appreciated. And this was a G20 event, so partnerships and collaboration very important. And of course, the heads of mission represented here, are very important partners for us. Let me also thank President Benedict Arama. Yusuf, if you can convey our gratitude to him. He's been a bastion of support for the continent, and again expressed that in his very insightful address this morning. Can I also thank and appreciate, even though he sent us a message and couldn't be here in person, the Secretary General of the Africa Continental Free Trade Area, Wamkele Mene, who is a hardcore champion of healthcare equity and healthcare industrialization. So, Themba, if you can thank the SG. Let me thank all the other government officials. And of course, I'm leaving the best two for last. Dr. Luwazi Manzi was an outstanding program director under difficult circumstances. Thank you very much for the way you manage things. Let me thank our researchers in the room, Glenda Gray and others. We are going to slightly amend the language for the statement to include research in that, Yavi. And very lastly, the hard taskmaster that put most of this together today was Yavi. So Yavi, we owe you a huge debt of gratitude. Thanks very much. And to the colleagues from the media, Janice and others, thanks very much. Media are an incredibly important partner, particularly at these difficult moments where we're seeing these seismic trade and tariff shifts. To the extent we are, it's really important that conversations such as this one get conveyed and transmitted beyond this room, and media are a very important partner for that. Then the Italian ambassador has left. I was going to thank him because he borrowed us Professor Giuliano from Naples University, who is doing the research work, and he's traveled all the way from Naples to be here with us today. Much appreciated. You're a good friend of South Africa. And of course, we look forward to the report. Can I lastly just indicate that DM Kekana, many people spoke about implementation today. Your department is the one responsible for public-private partnerships and monitoring and evaluating the progress thereof. So I'm going to re-thank you again in advance, because I know that you will drive outcomes from this meeting, because we said at the beginning, what we don't need is more meetings where we talk and talk. We need to see action and implementation. I know you as a DM, that's about action and implementation. So I'm already thanking you in advance, because you're going to get things done. So thanks very much to you. Okay, ladies and gentlemen, lunch is served. I think we're going to have to rush there because they're going to pack it away soon. Thanks very much.